Presented a study today. Was the preliminary results, safety and efficacy of a study called Keynote-028. This is a trial using a drug Pembrolizumab. It's a PD-1 antibody. This was a phase 1b multi-center international study using this drug in 20 different tumor types. Now, what we presented today was the mesothelioma cohort. The design of the study is patients who have had prior treatment for mesothelioma and had failed that therapy. Patients were all screened for, the tumors were screened for the presence of a marker called PD-L1. So these were all PD-L1 positive mesothelioma. Patients received treatment with Pembrolizumab at a dose of 10 milligrams per kilo every 2 weeks, and then were assessed for response after every 8 weeks of therapy. The results that we presented today were the initial safety and preliminary efficacy results. What we found was that overall the treatment was well tolerated. There were no unexpected toxicities, nothing that was new anyway. No patients had to discontinue treatment due to any kind of treatment-related adverse events. Our efficacy data, at least the preliminary data so far, we found that we had a total of 7 patients who responded to the treatment. It's a 28% response rate. But in addition to that, we also found 12 patients who had stable disease, where the disease didn't progress during the course of therapy. So overall, we have a disease control rate of 76%. This is important in this patient population. These were all second-line treatment patients. Historically, there is no proven second-line therapy for this disease, and chemotherapy has response rates usually 10% or less. So we felt these results were encouraging and certainly warrant further investigation of Pembrolizumab in mesothelioma. I think this is a glimpse of the future in this disease. This is showing that immunotherapy has a role in the treatment of mesothelioma, I believe. Certainly we need larger studies. This was a small 25-patient, highly selected enriched patient population, and there is a study that just opened that will be looking at, in a larger context, the treatment for patients with mesothelioma. It's, again, Pembrolizumab, but looking at not only just the PD-L1 positive patients, but also PD-L1 negative patients. And then, beyond that, I think looking at this drug in combination with other treatments, in combination with chemotherapy, combination with other immunotherapies, ways to enhance the response. 28% response rate is very encouraging, but certainly that means that there's a lot of patients who aren't responding. And if there's a way that we can try and enhance that response and enhance the duration of response, it'd be even better. If you look at mesothelioma, it's really a uniformly fatal disease. From the time of diagnosis with standard treatment, there's a standard chemotherapy regimen, a combination of cisplatin and pemetrexed. The overall survival, the median overall survival for this disease is around 13 months. So it's a bad disease and a bad prognosis. In the second line, there really is no therapy. So patients who relapse, there's no proven second-line treatment. So this is why this patient population is particularly of a need for treatment. So we feel that these initial data are encouraging in that regard.